bello. Welcome a new episode of Promoitalia Channel. Today we are in Greece. It's beautiful Greece, exactly in Athens, very close to Acropolis. But the main dish of today that we have with me two important guests. I have with me the Dr. Bukovalas.
Hello.
How are you?
Welcome to Athens.
Thank you, thank you. Dr. Bukovalas is a very important plastic surgeon here in Europe, of course, but especially in Athens, because we work especially in Athens. I have with me too even Dr. Celia, that is plastic surgeon from Dubai, from Egypt, and is even is trainer for Promeitalia worldwide. And why here with two plastic surgeons? Because the main issue today it is liposuction.
Absolutely.
About liposuction, I want to make immediately to you, doctor, what is for you liposuction. When it's when come a customer to you, you thinking immediately to use liposuction. What is your idea?
Look, in my offices we have surgical and non-surgical. But as a surgeon, the first thing we think is liposuction, of course. Then, if they don't want an operation, then we continue with our staff to talk about non-surgical. And there's a lot of solutions, of course, that Promoitalia can provide us with. So, liposuction is a very important type of surgery. It's extremely well advanced nowadays. It's got nothing to do with the old techniques. And of course, Promoitalia has found an incredible machine that perhaps Dr. Celia would describe even better than me. But it's very important nowadays that we talk about 3D, 4D liposuction.
Yes.
The old manner of liposuction that we used to just take fat out is long gone. Nowadays we need definition, we need great detail, we need machines that would give us precision to be able to have surfaces that are like converse and concave, shadowy and lighted.
Why machine? Not possible to do this definition with the hands too?
No way.
No way.
Do you agree?
Yeah, I totally agree about what you said. Long time ago, we used to have liposuction that the patient come and ask, okay, I want to remove the fat of my belly. Today it's not like that. They want drawings, they want curves. The men, they want six packs. And machines have helped us a lot into improving our techniques and improving to decrease the amount of blood and to have a more pure fat. We can use that fat also to be injected above the muscles for men, to do more curves for women. And machines are very, very, very important because it makes the full experience way easier and at the same time safer.
Yes, and the man he wants six packs, the woman want the definition about abdominal anyway.
They want the curves.
The curves, right?
Well, but apart from the curves, even in the abdominal area, there's the 3D for women. It's slightly different than men. For example, instead of making a longitudinal line that is wide in the top and very thin in the bottom, we make two triangles. Yeah. So the drawing is similar but not identical. It's slightly different, but there's a specific way of doing women's and men's abdomens, always with the aim of producing a result that looks like a very well exercised and trained body.
Good. It means that if we want HD, we need to use a machine, right? Perfect.
Absolutely, with a machine.
And what will be the rest? We have some risk for the machine, for the patient,
The risks are minimal because in this machine, specifically about this machine, the probe never exceeds temperature of 40 Celsius, which is very safe. A lot of other devices, they didn't take much of care about this problem, and maybe some had to cause some problems, but this device specifically is very safe. I've been trying it, I've been using it many times, and it's amazing.
Good. And after surgery, there is some time that you need to recover. What is in the procedure after? Because it's important to understand what is for our customer that follow us, what is
For plastic surgeons, it's very important to take care of everything concerning the patient. So if you have a patient with a very good hematocrit, for example, then you can remove a lot of fat. If somebody has not got a very good hematocrit, then you have to be a little bit more careful. in your case, the Promoitalia machine is better because it causes very specific damage to the tissue and it avoids, and generally speaking, all the machines that are using ultrasound are better than the traditional liposuction, because what they do to the cell is they absolutely make it collapse. In other words, there's what happens to the fat cell with the ultrasound is an impulse. The cell breaks down. So if you have the machine of Promoitalia, there's a great advantage because it doesn't exceed 26 degrees, and therefore you can be very precise and you can be sure of avoiding any possible complications that have been noted in the bibliography.
And
sorry, I wanted just to tell our audience the importance of why are we using power or ultrasound assisted machines, because it saves time and saves effort in the surgery room, and thus the downtime for the clients is much less because you don't use a lot amount of force on the tissues.
Okay, a question that some customers sometimes say to us, but it's important you expert, is a huge expert, but better to answer right way now. It's some customers tell us if after the liposuction, okay, and I eat a lot, and so in the part that had liposuction, I can make again fat or not?
No. What happens is the fat cells are cells that are unique. Even unlike nerve cells that may be able to regenerate, fat cells would never regenerate. So what happens when you have an area of obesity? There's more and fatter fat cells. So liposuction of any type or kind reduces this number of fat cells. That doesn't mean that it eliminates them. Therefore, it's more likely if you gain fat to gain it in other areas.
In other side, in other part, not of course.
That's why there's the public relief that the fat moves around. The fat doesn't move around and it doesn't regenerate. Once you remove 1 million fat cells from one area, there's 1 million fat cells dead.
It's very important to know because someone know that is you can again, because this is
but on the other hand,
I always tell my clients, okay, I give you this shape for this weight. If you gain more than 5 kilos, then you start to change, because the fat cells are storage. So whatever fat or food you are providing them, they shrink or expand depending on the amount of food you're providing to them. So as long as the patient remains within the same 2-3 kilos ups and downs, they're going to have the same shape.
Absolutely, and the other thing is you do give them the chance of eliminating some areas that are not happy with. Therefore, they might change their mentality and change their entire way of living, of exercising, their nutritional habits and everything. You give them the chance to eliminate the problem, which is localized.
Yes.
And it's up to them to be...
Wellness education.
Yes, exactly. They have to change their way of
the life, yes.
And not gain any weight.
And about that liposuction in general, it's what is the time that people need to stay in clinic after the surgery? 1 day, 2 days?
2 hours.
2 hours. And after?
It depends on the machine and the technology, but usually, in my case, we do all the liposuctions, all of them, with local anesthetic and sedation. And it takes, let's say, 1.5 to 2 hours, depending on the area, and then they stay in for 2 hours wearing a pressure garment. After that, they leave the hospital and they go home, and maybe the next day, particularly, we ask them to come back just to check up on them, but it's not necessary.
And the full result, in what is the time that they can see? 1 month, 2 weeks?
I would say 2 months. I would say 2 months.
For HD, of course.
For HD, yes, because it takes much time to for the swelling to resolve. The shape itself, it changes until 6 months. But if they are looking for a precise or to be happy, when would the client be happy? I would say around 2 months.
Let me put it that way. They can see the result immediately before they get swollen again.
Yeah.
And especially with high technology machines like the Promelter, for example, they see the result very quickly. Initially, if they wear their pressure garments properly, they have an amazing result within a few days. And then it gets better within a month, then it gets better within 3 months, and then 6 months. So when they want to grade up the surgeon and say, you're wonderful, they have to wait for 6 months. But that doesn't mean that they have to wait for 6 months.
Immediately you already see. Immediately you can see, and after in the 6 months you have the best solution.
Like in 1 month when they come back to the office, they're completely different in the area that we've done.
Well, good to know. And I want to thank, Dr. Boukouvalas with us, that enjoy with us this channel, that give, the news about expert, for the liposuction. Thank you for Dr. Celia, that give you, advice about liposuction too. Thank you for our follower. We see in new episode of Promoitalia Channel.